The night shift at Seattle General smelled like antiseptic and defeat. Margaret Walsh arrived at 11 p.m. sharp, the way she arrived every Tuesday through Friday, quietly, without fanfare, without expecting anyone to notice. 3 years. 1,095 shifts. Not that she counted. The silver threading through her dark hair caught the fluorescent lights as she pushed through the staff entrance, her scrubs already wrinkled from the drive through Portland rain, her orthopedic shoes silent on the linoleum floor. Most of the day's shift had cleared out by the time she reached the cardiac unit. A few nurses lingered at the station, charting their final patients. When Margaret approached, one of them nodded, a small acknowledgement of competence, the kind of respect earned through 3 years of solid work and zero drama. She'd learned to live on nods. The cardiac unit at 2 a.m. was its own world. Monitors beat their steady rhythm, a mechanical lullaby for the dying. The ventilators wheezed in synchronized breaths. Margaret moved between rooms with the economical precision of someone who'd learned to do twice the work using half the energy. Her hands moved through vital signs, through medication checks, through the 1,000 small interventions that kept broken hearts beating. But when she lifted a patient's chart at the medication dispensary, her left hand tremored slightly. She compensated without thinking, a movement so practiced it had become invisible. She touched her left ear, tilting her head to favor her right side, adjusting for the hearing loss that no one at Seattle General knew about. The IED blast at Bagram that had taken 60% of her left ear's function was a story she didn't tell. Nobody asked. Nobody wanted to know. That was the unspoken agreement of night shift nursing. You showed up, you did the work, you kept your secrets pressed against your ribs like shrapnel you'd learned to live with. At 2:27 a.m., she noticed the post-operative medication logs. Her finger traced the entries in the computer system, then back to the printed charts. Dosage discrepancies. Timing inconsistencies. A patient prescribed 2 milligrams of morphine for post-op, but the log showed only 1 milligram recorded. Another patient listed for 100 milligrams of succinylcholine, but the dispensary count was off by 50 milligrams, small gaps. The kind of gaps that might mean nothing. Or the kind of gaps that meant someone was covering something up. Margaret's eyes narrowed. She'd seen similar patterns before, not at Seattle General, but in combat support hospitals in the Panja Valley, where a medic had been diverting pain medication for personal use, and a patient had coded unnecessarily because of inadequate anesthesia coverage during a field procedure. She pulled up 3 more patient records. The pattern repeated. Every single discrepancy involved post-operative complications that hadn't been fully documented. Every gap in medication corresponded to a patient who deteriorated faster than expected. The fluorescent lights hummed overhead, that constant mechanical drone that made the night shift feel like you were working inside a dying machine. Margaret printed the logs. She was going to bring this to the charge nurse, to pharmacy, to whoever needed to know. This was protocol. This was what you did when something didn't add up. She didn't hear the Italian loafers clicking across the tile until Dr. Ashford was already 6 inches behind her. Something interesting, Nurse Walsh. His voice carried the casual menace of a man who'd learned that authority could dress itself in pleasantness and nobody would notice the teeth underneath. Margaret closed the log carefully. Her movements didn't accelerate. Her breathing didn't change. 3 years of night shifts had taught her how to respond to men like Ashford, doctors who saw nursing as a lower order of work, a supporting role in a drama where they were always the lead. Just reconciling the counts, doctor. Her voice came out level, deferential. A nurse's voice. Not the voice that had called in coordinates under fire. Not the voice that had ordered for Rangers to move now or die here. He smiled without warmth. How thorough. His eyes moved from her face to the printed logs in her hands. The smile tightened. We have systems for that, you know. Actual protocols. I'm aware of the protocols, doctor. These numbers seemed, are you suggesting there's a problem with our systems, Margaret? He used her first name the way a principal used it with a misbehaving student. The way a man used it when he decided to establish dominance. Margaret didn't flinch. She'd been called worse things by better men, and she'd kept her composure while doing it. "I'm suggesting the numbers don't match, Doctor. That's all." He stepped closer. His cologne, something expensive, something that cost more than her entire week's salary, filled the space between them. "Our numbers are fine. Our systems are fine. What we don't need is a night shift nurse playing detective." The words landed like a slap, but her face remained neutral. "Understood." She placed the printed logs on the counter. He picked them up, tore them in half with deliberate slowness, and dropped the pieces in the trash. No more creative auditing. Stick to taking vital signs. His loafers clicked away across the linoleum, leaving her standing at the medication dispensary with her hand steady and her jaw clenched so tight it felt like it might crack bone. She needed to breathe. Just breathe. She turned back to the monitor screens, back to the beeping rhythm, back to the work that nobody asked questions about. But that wasn't the worst part. That wasn't even the moment that would matter. At 4:17 a.m., the medevac alert came through the overhead intercom, not the usual pediatric patients or car accident victims, but a Coast Guard medevac, which meant someone important was coming in bleeding. The rotor wash from the helicopter hammered against the hospital's emergency entrance like artillery fire, a sound Margaret's nervous system recognized as a call to action before her conscious mind even processed it. She heard the ambulance bay doors slam open. She heard paramedics calling vitals in that controlled panic voice they used for casualties with survival rates that ran below 50%. Male, mid-50s, multiple shrapnel wounds to left chest and abdomen, shipped from a Coast Guard interdiction operation gone wrong 36 minutes ago, currently responsive but hemorrhaging heavily, 3 units whole blood already running, BP dropping, we need trauma surgery now. The emergency bay filled with the controlled chaos of a major trauma. Margaret moved toward it without being asked. This was the one thing the night shift was good for, the one thing nobody could tell you not to do, because crisis didn't care about protocol or hierarchy or whether a doctor had specifically told you to stay in the cardiac unit. Commander Hayes came through on the stretcher like a ship being salvaged. His left side was a geography of trauma. The shrapnel from whatever IED or mine or RPG had caught him mid-patrol had carved new terrain into his ribs. His uniform was soaked through with blood that looked almost black under the fluorescent lights. His right eye was swelling shut. His breathing was shallow, labored, the kind of breathing that told you his left lung was collapsing. Margaret reached the trauma bay as the nurses were transferring him from the medevac stretcher to the hospital stretcher. She assessed in 3 seconds flat, the kind of assessment that came from training, from experience, from the particular education you got when you worked in a support hospital in a combat zone. The sound of his breathing was wrong. The rise and fall of his chest was asymmetrical. His O2 sat was dropping, 88, 85, 82. Blood loss at this rate meant cardiac arrest in less than 4 minutes. She didn't wait for permission. She was already moving toward the crash cart, already pulling out the needle decompression kit, her muscle memory taking over like she was still 28 years old and Major Margaret Walsh instead of 46 and just Margaret, the quiet night shift nurse with the silver hair. "Second intercostal space, mid-clavicular line," she said, more to herself than to anyone else, but the resident in the bay heard it and froze, because nurses didn't call out anatomical landmarks. Nurses didn't perform interventions before being told. Nurses didn't move with the terrifying fluid precision of people who'd done this before under conditions most of the medical staff in this building couldn't imagine. Margaret swabbed the site with antiseptic. The hiss of the needle going in was barely audible over the alarm of the dropping O2 monitor. She hit the chest wall at the exact angle, between the ribs, through the parietal pleura. Air rushed out, that distinctive hissing escape of a pneumothorax decompressing. O2 sat climbed, 84, 87, 90, 92. The breathing normalized. The asymmetry evened out. Commander Hayes's eyes opened slightly, and he looked at the silver-haired woman who'd just saved his life with a motion so precise it had taken maybe 90 seconds. "Thank you," he whispered. His voice was paper-thin. Margaret was already stepping back, her hands dropping to her sides, her composure sliding back into place like armor. "Doctor will be right with you, Commander." She used his rank without thinking. Muscle memory. The resident was staring at her like she'd just done something impossible. And then Dr. Ashford arrived, his Italian loafers clicking across the trauma bay floor, his face already tight with the fury of a man who'd walked into a room and found someone else handling his patient. He took one look at the needle decompression site, at the normalized oxygen SATS, at the commander's stabilizing vitals, and something dark crossed his face. Not relief. Not gratitude. Just rage. Pure, undiluted rage at a night shift nurse who'd stepped outside her lane and done his job before he'd gotten there to do it. Nurse Walsh stepped back from the patient. His voice was steel-wrapped in ice. Margaret stepped back. She moved to the corner of the trauma bay and waited, watching, her composure intact, her heartbeat steady, her hands absolutely still. She'd made a decision in those 90 seconds that would unravel everything. She'd revealed something. Not her identity, nobody would learn that for 7 more days, not until a federal investigator showed up with documentation that would turn the hospital upside down. But she'd revealed competence. She'd revealed knowledge. She'd revealed that the quiet night shift nurse with the silver hair was something other than what anyone had assumed. And Dr. Ashford had seen it. He'd seen the crack in the facade. And men like that? Men with power and fragile egos? They spent the rest of their careers widening those cracks. They spent every day trying to make sure that crack turned into a chasm you could never climb out of. The schedule changes appeared on the staff board at 6:45 in the morning, printed in Ashford's precise clinical handwriting. Margaret stood before the roster with her coffee cooling in her hand and read her name paired with general ER rotations, effective immediately. Her shifts, all nights, all opposite rotations from Sarah, Marcus, Linda, and Katie, the 4 nurses she'd trained to catch the small details that separate adequate from excellent. She took one measured breath and continued to the time clock without another glance. Ashford announced it during morning rounds like it was routine, like reassigning one of his most experienced nurses away from the cardiac unit where she'd worked for 3 years was simply administrative efficiency. 15 staff members stood in the hallway outside the patient rooms, their eyes tracking between Margaret and the tall doctor in his white coat, the one whose family name carried weight in 3 Pacific Northwest medical foundations. "We're shuffling some assignments," Ashford said, his voice smooth as a surgical blade. "Walsh, you'll provide better value in the ER. Your particular skill set seems more suited to general practice." The emphasis on particular hung in the air like the smell of antiseptic after a code, something sharp and chemical that made your eyes water if you thought about it too long. 2 physicians in his orbit exchanged glances that required no words. Margaret's jaw tightened, her hand steady on her coffee cup. "Understood, doctor," she said quietly, the deference automatic, the composure of someone who had learned long ago that reactions were ammunition. But something in Ashford's expression shifted, a flicker of frustration that her acceptance didn't provide the resistance he'd been seeking. The first real humiliation came 3 hours later in room 347. Commander Hayes had arrived via Coast Guard medevac, a shipping interdiction operation gone wrong, shrapnel embedded in his shoulder and left side, his breathing already showing the signs of complications developing. His teenage daughter gripped his hand, terror making her fingers white-knuckled, and Margaret assessed the patient with the systematic efficiency of someone who had done this 1,000 times. She saw what was coming before it arrived, the subtle rise in respiratory rate, the increased work of breathing, the oxygen saturation already beginning its downward slide. Tension pneumothorax. The kind of thing that killed people in 4 minutes if you waited for permission. Margaret reached for the 14-gauge angiocath from the crash cart, her hands moving with the muscle memory of training that predated her nursing license by a decade. She prepped the second intercostal space, mid-clavicular line, felt the slight give of skin and fascia as the needle advanced, and the rush of air that followed, that hissed like a deflating tire, like pressure escaping, like the commander's lungs suddenly getting the oxygen they needed. His breathing eased. His color improved. His daughter's grip on his hand loosened fractionally. Then Dr. Ashford entered through the sliding doors. His face flushed like someone had turned a valve, the pink spreading from his neck upward with the predictable progression of male anger. "What the hell do you think you're doing, Walsh?" His voice carried across the room like it was designed to be heard by every staff member within 50 feet. "Did I order that intervention?" Margaret kept her hand steady as she withdrew the needle, kept her voice level and precise. "He was developing a tension pneumothorax, doctor. He had maybe 4 minutes before cardiac arrest." Ashford stepped closer, his body language shifting into the posture of dominance, and when he spoke again, his words were calculated and public and cruel. "You don't make those calls, Nurse Walsh. You're not a physician. You're not even a competent nurse from what I'm seeing lately." He turned to Commander Hayes's daughter, his smile friendly now, rehearsed. "I apologize for this overreach. Grandma here thinks 30 years of emptying bedpans makes her qualified to practice medicine." One tear escaped Margaret's eye, trailing down her cheek in the hot fluorescent light of the trauma room. She could feel the commander's daughter staring at her, could sense the confused hurt on that young face. But Margaret wiped the tear away slowly, deliberately, and met Ashford's gaze across the patient's bed with eyes that had seen worse than humiliation. "Much worse. I treated the patient's tension pneumothorax because he would have died in 4 minutes, doctor," she said quietly, her voice dropping into the register it only used when she was absolutely certain. "Was there a protocol I missed for letting that happen?" Ashford's jaw clenched, but Commander Hayes's daughter was looking at the quiet nurse differently now, with something that wasn't sympathy but recognition, the way people looked at someone who had just done something extraordinary and refused to take credit for it. The second humiliation came the next morning in the break room. Margaret had finished her 12-hour ER rotation, her scrub soaked with the accumulated fluids of a chaos shift, blood, sweat, saline, things that wouldn't wash out until the third cycle of the hospital laundry. She made a cup of coffee from the staff pot, the dark liquid bitter and cold by the time she sat at the corner table where she usually debriefed with her team. Sarah was already there, along with Marcus, Linda, and young Katie, whom Margaret had personally trained for 18 months, mentoring her through the difficult shift where Katie's first patient coded and died despite everything they tried. The 4 of them had their heads together when Margaret sat down, their voices dropping immediately. Sarah's coffee cup was still steaming. She hadn't been here long. The moment Margaret pulled out her chair, Sarah stood. "We should get back." Not a question. Not even really a sentence. Marcus gathered his phone. Linda moved toward the door without looking backward. Only Katie hesitated for a second, guilt written across her face like a diagnosis, the kind you see once and understand immediately. She glanced back at Margaret, apology in her eyes, before following the others out of the break room. Margaret sat alone at the table with her cold coffee and her wet scrubs and the knowledge that Ashford had done exactly what he'd intended. The fluorescent light above her flickered in the pattern it always did, the electrical ballast making a faint buzzing sound that set your teeth on edge if you listened for it. She lifted her coffee cup with a hand that didn't shake, even though her stomach was tightening into knots, even though she wanted to scream, even though something inside her, the part that had survived IED blasts and medevac flights and the death of things she'd sworn to protect, was learning to recognize the particular loneliness of being actively exiled by your own unit. She took a sip. The coffee was cold. She finished it anyway. The third humiliation was permanent. Dr. Ashford posted a formal written warning on the unit board where every staff member passed at least 3 times during a shift. The paper was printed on official Seattle General letterhead, and the message was simple and devastating in its clarity: Margaret Walsh, formal citation, insubordination and unauthorized treatment decisions. Pattern of overstepping scope of practice. Patient safety concerns raised. 20 staff members passed that board every hour. 50 would see it today. Margaret stood before it during shift change, reading each word while she could hear whispers behind her, the kind of whispers that happened when authority had given permission for judgment. Her chest tightened, her eyes burning, and she felt the tears coming like a storm she couldn't prevent. One tear traced down her cheek before she could stop it, before she could pull herself back to that place of control where emotions were data, feelings were information to be filed and stored rather than displayed. But she turned, slowly, deliberately, and met Ashford's triumphant gaze across the nurse's station. His smile was the smile of someone who believed he'd won. His posture was the posture of a man who thought he'd broken something that couldn't be repaired. Margaret's voice when she spoke was quiet, level, and absolutely clear. "I treated the patient's tension pneumothorax because he would have died in 4 minutes, doctor. Was there a protocol I missed for letting that happen?" Ashford's smile widened, but something flickered behind his eyes, frustration, perhaps, that she wasn't crying harder, wasn't quitting, wasn't giving him the escalation he was seeking. "Keep digging that hole, Grandma," he said, turning back to his charts. Margaret returned to her shift in the ER, where Commander Hayes had been transferred after his initial assessment. She noticed things no one else did. His chest X-ray showed fragment migration that contradicted Ashford's assessment that the commander's injuries were stable. His oxygen saturation had dropped 3 points since the previous evening, incrementally, subtly, the way deterioration sometimes moved when it was being masked rather than treated. His cardiac rhythm showed subtle T-wave changes that should have warranted investigation. She documented everything with meticulous precision, each observation dated and timed, because she knew Ashford would dismiss her concerns just as he dismissed her expertise. During afternoon rounds, she presented the findings. Ashford didn't even look up from his iPad. "Your job is to follow orders, Walsh, not practice diagnostic medicine." She added the observations to the chart anyway, her name signed beside each note in her precise handwriting, evidence and testimony combined. On her second overnight shift since the reassignment, something changed. Margaret was restocking for kits in the supply room when she overheard Ashford's voice from the staff corridor, his cell phone pressed to his ear, his tone low and urgent in a way that professional conversation never required. "The Coast Guard patient needs transfer authorization," he was saying. "I need him moved to Naval Hospital Bremerton by Friday." "Yes, I know he's stable. That's exactly why we should move him now." Margaret froze with her hands full of supplies. The urgency didn't match the medical picture. Commander Hayes was improving, his oxygen levels stable, his pain manageable. There was no clinical reason to transfer him. She stood motionless until Ashford ended the call, until his footsteps moved away down the corridor, and then she carefully finished restocking the supplies and walked to the cardiac unit. Commander Hayes's chart showed no transfer orders written. No medical justification documented. Nothing that would explain Ashford's phone call. Margaret pulled the medication logs from the cardiac unit again, her hands moving with the deliberate precision of someone conducting an investigation, and began cross-referencing patient outcomes with Ashford's post-operative cases. What she saw was a pattern: 6 patients across the past year, all showing complications inconsistent with their procedures, all with medication records that had been altered slightly, carefully, in ways that would be invisible to anyone who wasn't looking for them. The kind of alterations you might make if you needed to hide something. The kind of careful documentation fraud that meant someone knew exactly what they were doing. Commander Hayes had been in the cardiac unit for an initial assessment before his emergency room admission. Margaret's hands began to shake as she stood with the medication logs in her hands. She looked around the empty corridor and then carefully, very carefully, photographed each page with her personal phone. The pictures were grainy but readable: evidence, documentation, proof. She slipped the phone back into her pocket and returned the logs to their secure location. The next morning, she arrived for her shift to find her access badge wouldn't open the cardiac unit medication room. The security system at the door showed her clearance had been revoked at 7 in the morning, 20 minutes after Ashford had arrived for his shift. Margaret stood before the electronic lock for a long moment, her jaw tightening, her hand steady as she turned away and walked toward the general ER, where the quiet work continued without her, where Commander Hayes was beginning to notice details that no one else had caught, where the first thread of a pattern was about to unravel in ways that no one, least of all Dr. Ashford, could have anticipated. Commander Hayes stabilized over the next 30 hours in a way that looked good on the surface but felt wrong to Margaret the moment she reviewed his afternoon chest X-ray. The film showed what it always showed: shrapnel fragments scattered across his right lung field like confetti, but there was something new. A fragment had migrated. Half an inch. Maybe more. The kind of movement that happened when pressure changed inside the thoracic cavity. The kind of movement that meant something was building. She didn't mention it to anyone yet. Not to the day shift nurse. Not to the resident who breezed through on rounds. She simply documented it. Chest X-ray reviewed 1,400 hours. Fragment migration noted in right apical region. Clinical correlation recommended. The words were careful, measured, the kind of clinical observation that created a paper trail without accusation. Margaret had learned long ago that documentation was armor. Every observation written down became a fact. Every fact became evidence. By evening, Hayes's oxygen saturation began its slow descent. 97% at noon. 95 at 3. 92 when Margaret came back to check on him at 1,730 hours, still technically off her shift but unable to leave. She stood at the monitor for a full minute, watching the number drop another point. 91. The ventilator wheezed its mechanical rhythm in the quiet room, and Margaret could hear something else underneath, the sound of a pressure system failing, the whisper of air finding the wrong places. She pulled Hayes's chart and began adding notes. O2 sat declining incrementally over 6-hour period despite stable ventilator settings. Breath sounds diminished on right. Patient reports sensation of chest tightness. Each sentence was a brick in the wall she was building, a structure of observation that would hold up under scrutiny. She was documenting not for the attending physician. She was documenting for whoever came after, for whoever would need to understand the timeline, the deterioration, the warning signs that someone had seen and recorded before everything changed. The thing about tension pneumothorax was that it didn't announce itself. It whispered first, a drop in oxygen saturation that could be attributed to a dozen things. A decrease in breath sounds that might be normal post-operative settling. A patient's mention of chest tightness that could be pain, could be anxiety, could be nothing at all. But Margaret had held pressure dressings on penetrating trauma in rooms lit by muzzle flashes, had felt the moment when air trapped in the wrong space began to collapse a lung, had learned the signatures of a body slowly choking itself. She knew the rhythm. Knew the progression. She was standing at the nurse's station at 1912 hours when the monitor alarm cut through the evening shift change like a knife. High-pitched, insistent, the sound that meant a heart had stopped doing what hearts were supposed to do. Margaret's head came up. Room 347. Commander Hayes. The crash cart was on the 3rd floor. The attending resident was in the cafeteria. Dr. Ashford's extension rang to voicemail, his cell phone going to voicemail, the way it always did when things went wrong. Margaret moved. Not ran. Walked with the purposeful precision of someone who had already made every decision that needed to be made. The hallway opened before her like something parting for her passage. Behind her, she heard the nursing station erupting into chaos, call lights, orders, the mechanical scramble of a hospital trying to organize itself around crisis. Ahead of her was room 347, and in the doorway stood Commander Hayes's daughter, frozen mid-breath, her hand pressed against her mouth, watching her father's chest go still. Margaret didn't stop. She pushed past into the room where Hayes lay motionless, where the monitor showed a rhythm that shouldn't exist, electrical activity with no mechanical follow-through, the heart generating signals its damaged structure could no longer execute. Code Blue, room 347, Margaret called, her voice carrying the kind of authority that didn't ask for permission. Code Blue. She was already at the bed, already positioning her hands, already beginning compressions with the kind of force that came from understanding that 60 compressions per minute was slower than death and faster than resurrection. Get the crash cart. Now. The code nurse arrived, a young woman named Stevens, competent but new, someone who hadn't yet learned the texture of impossible decisions. Margaret continued compressions, feeling the cage of ribs respond, feeling the resistance underneath. Something mechanical. Something blocking. Air or fluid or pressure building where it shouldn't be. Another pneumothorax, maybe. Or cardiac tamponade from the shrapnel migration she documented. The heart couldn't beat against pressure like this. Couldn't generate rhythm against a wall it couldn't push through. Epi, Margaret said. Stevens had the syringe ready, the 1 milligram in the 4 line, the push that would flood Hayes's system with the chemical equivalent of a scream. The monitor remained unchanged. Asystole. Flat line. A heart that had forgotten its own rhythm. 30 compressions. 2 minutes. The crash cart arrived with the attending resident, a doctor named Paulson who'd been taught his medicine in textbooks and simulations, who understood theory but hadn't yet felt the moment when theory met the terrible arithmetic of a body dying in real time. Continue compressions, he said, which Margaret was already doing. Let's get a 12 lead. Check for mechanical obstruction. Margaret could have told him. Could have explained what she already knew from the angle of resistance, from the feel of the heart against her palms, from a decade of field medicine in places where you didn't get to wait for imaging. But instead she said, pneumothorax or tamponade. Mechanical obstruction. He won't convert. 2 compressions per second. 100. 120. We're not beating this. Keep going, Paulson said, but his voice had the tone of someone following protocol when protocol had already failed. 90 seconds. That was the window. Maybe 120 if the body was lucky. After that, the brain began to die, the tissues began their irreversible cascade toward permanent silence. Margaret could see the clock on the wall. Could measure her own heartbeat against the compression rhythm, could feel the architecture of everything she'd built in civilian medicine, the quiet work, the invisible victories, the promise she'd made to keep this part of herself buried. Scalpel, she said quietly. From the surgical tray. The resident stared at her. What? Scalpel. Now. 14 blade. We can't, the protocol is. He'll be dead in 90 seconds. Scalpel. Something in her voice, not loud, not commanding in the way of someone who raised their voice, but carrying the kind of weight that came from having already survived things that killed other people, made Stevens move. The resident didn't stop her. Stevens brought the instrument tray, and Margaret's hands moved the way hands moved after 37 months of combat surgery, after learning anatomy not from textbooks but from the terrain of human survival. She positioned the blade at the 5th intercostal space, mid-clavicular line. Skin parted. Muscle. Fascia. Ribs spread with the kind of force that took training and the kind of certainty that came from knowing the alternative was death. The pericardium was distended, fluid-filled, the sac around the heart pressing in like a fist. Margaret made one deliberate cut, and the fluid released, a hiss of pressure escaping, the sound of air finding places it was supposed to be. 80 milliliters of blood that had been crushing the heart from the outside. She reached into the cavity of Hayes's chest and felt the organ beneath her fingers, still and wrong. Her hand closed around it. Massage. Firm, rhythmic pressure. Come on. Come on. The resident was saying something. Stevens was saying something. But Margaret's world had narrowed to the space between her ribs and the heart in her palm, to the muscle memory that didn't distinguish between a Bagram operating tent and a Portland hospital room, to the simple arithmetic of keeping something alive that wanted to die. 50 compressions. 75. 100. And then a beat. Not strong. Not steady. But present. The heart in her palm contracted against her fingers, and Hayes's monitor changed. From flatline to something that resembled rhythm, something that resembled hope. Sinus rhythm, Stevens breathed. We have sinus rhythm. Margaret didn't remove her hand. Didn't move. Held the heart steady while it remembered how to beat, while the electrical signals and mechanical responses found their way back to coordination. 30 seconds more. 60. When she was certain, when she was absolutely certain the rhythm would hold, she withdrew her hand and began the careful work of closing the thoracotomy, each layer methodical, each suture a prayer for a man who didn't know what had just pulled him back from the edge. 17 minutes later, the ER doors opened and Dr. Ashford walked through. His eyes went straight to the monitor. Saw the rhythm. Saw the blood. Saw Margaret's hands as she completed the final closure, her gloved fingers steady, her jacket stained with the evidence of everything she'd just done. His face went white. Then purple. Then a shade of red that suggested all the rage a man could accumulate when his power was being demonstrated as insufficient. He didn't congratulate her. Didn't acknowledge the save. Didn't look at the patient whose heart was beating again because of what Margaret had decided in a moment when there was no time for decisions. Instead, he leaned close to her ear, his voice a whisper that only Stevens could hear, and said, "My office. Right now. And bring your credentials." Margaret finished the last suture. Tied it off. Stepped back. Looked at Commander Hayes's restored sinus rhythm on the monitor, the numbers climbing, the body responding. Then she turned to Ashford and met his eyes. "I'm going on break first," she said quietly. "I need some jello." For one impossible second, no one breathed. Not Stevens. Not the resident. Not even Ashford, who stared at her as though she'd just spoken in a language that had no translation. Then Margaret stepped past him, removed her gloves with a kind of deliberate precision that made every movement count, and walked toward the break room, leaving the hospital to draw its own conclusions about who had just saved the life of a man the hospital's most powerful doctor had already decided to sacrifice. The intercom crackled. Code Blue, Trauma Bay 3. Margaret was already moving, her hand steady as surgical steel. Commander Hayes lay motionless on the monitor, his rhythm flat as a line drawn with a ruler. No pulse. No perfusion. For minutes until irreversible brain damage. She didn't hesitate. She didn't blink. "Push 1 milligram epinephrine 4, she called, her voice cutting through the chaos like a scalpel. The resident scrambled. Compressions. Hard. Fast. "We need perfusion now." A nurse, Sarah, one of the newer ones, began chest compressions, but Margaret could see it immediately. Shallow. Ineffective. The woman's hands were shaking, her rhythm off by half a beat. Margaret stepped in, her hands taking over, finding the right intercostal space between the third and fourth ribs with the precision that came from something deeper than nursing school. Muscle memory. Combat field surgery. The kind of skill that came from holding a man's life together while bullets punched through the wall behind you. O2 sat. Margaret didn't look away from the monitor. 68 and dropping, the resident answered, his voice cracking. Hayes's chest wasn't rising properly. The tension pneumothorax had worsened. His left lung had collapsed again, compressing his heart, strangling his circulation. Margaret saw it the way she'd seen 1,000 impossible situations before, not as a problem, but as a door with a single, narrow solution. She reached for the surgical tray without asking permission, her fingers closing around the number 10 scalpel like it was an old friend. The blade caught the light. "What are you doing?" The resident's voice rose in pitch. "What needs doing?" Margaret said quietly. She prepped the site with antiseptic, the sharp chemical smell cutting through the metallic tang of blood, and found the landmark. Mid-axillary line. Fourth intercostal space. Anatomically, it was the same as it had been 23 years ago at Bagram when she was cutting through tactical gear and body armor under incoming fire, when the difference between right and wrong was measured in seconds and blood loss. The scalpel went in smooth. Deep. Decisive. The hiss of air escaping came like a sigh. Like a prisoner released from a cage. Immediately, Hayes's oxygen saturation began to climb. 75, 82. 88, Margaret's hand went into the thoracic cavity, and her fingers closed around a heart that had stopped beating. She didn't think about the fact that she had no authorization. That this violated every protocol Seattle General had written across 30 years. That the credentials hanging around her neck said registered nurse and nothing more. Her hands moved on their own, driven by the muscle memory of a field surgeon who'd trained at Fort Sam Houston and operated under fire in Loga Province. The compressions were different from the outside. Internal. Direct. Controlled. The myocardium responded beneath her palm. Once. Twice. The electrical activity on the monitor began to shift. Their sinus rhythm. A beat. Then another. A rhythm establishing itself like a drummer finding the tempo. O2 sat 91 and climbing, Sarah whispered, her voice full of something like religious awe. Margaret's hands continued their work, gentle now, Purposeful. Ensuring perfusion. Ensuring life. She glanced at the clock. 3 minutes and 40 seconds from code call to resuscitation. Not 4. Better than 4. She was already preparing to close, reaching for the sterile dressing, her movements economical and precise, when she felt the energy in the room change. The air pressure shifted. Someone had entered. Someone important. Dr. Ashford stood in the doorway, his face arranged for authority and control. Then his eyes found Margaret's hands inside Commander Hayes's open thoracic cavity. His expression transformed. The color drained from his face not with relief, but with something far deeper. Fury. Rage. The look of a man watching his kingdom crumble. What in God's name? His voice came out strangled. Tension pneumothorax, Margaret said, still working, still closing. Unresponsive to compressions. He was dead in 3 minutes if I didn't intervene. She didn't look at him. She didn't need to. She could feel his collapse like a physical force. A man watching his control slip away. A man watching a woman, a mere nurse, a nobody from the night shift, save a patient he'd already written off. Ashford's hands clenched into fists. His breathing came fast, shallow, the way a wounded animal breathes when it realizes it's trapped. 17 minutes. It had taken him 17 minutes to respond to the code. 17 minutes during which Margaret had done what he couldn't have done, what he probably would have bungled if he'd been here. 17 minutes during which she'd already won. By the time Margaret secured the last suture, Ashford had already pivoted. She heard him on the phone before she'd finished removing her gloves. His voice carrying down the hallway, louder than necessary, making sure people heard him. Administrator Chen, I need you here immediately. We have a serious protocol breach. The nurse has performed an authorized surgery, complete violation of scope of practice. The words came rapid fire, each one a weapon, each one designed to reframe what had just saved a man's life into something reckless. Something dangerous. Within the hour, Margaret found herself in Ashford's office while he made 3 more calls. The credentialing committee. His mentor on the medical board, some surgeon upstate who owed him favors. Each conversation painting her as a liability. A reckless operator playing doctor. A nurse who'd overstepped catastrophically, who'd endangered a patient with her unauthorized procedure. Margaret stood quietly, her hands clasped behind her back, watching him work. His face flushed. His voice projecting authority and concern. He was good at this, she realized. The political theater. The narrative control. The way he could make life-saving sound like negligence if you weren't listening carefully. Administrator Chen arrived within 2 hours, her face grave, her bearing formal. She didn't meet Margaret's eyes. Nurse Walsh, Chen said, and then corrected herself as though she'd made an error. You performed an emergency thoracotomy without authorization. Without physician oversight. Without. She trailed off, searching for words that would make sense of it. That would make it sound reasonable to suspend the woman who'd just saved a commander's life. For minutes, Margaret said quietly. That's how long he had before permanent cerebral hypoxia. No physician was present. Dr. Ashford was unreachable. Commander Hayes was in cardiogenic shock. I performed emergency thoracic decompression with a standard surgical scalpel, manually massaged the myocardium, and restored sinus rhythm in 3 minutes 40 seconds. Each sentence came out level. Factual. The voice of someone stating medical reality rather than defending herself. He's alive. That's the protocol I followed. The protocol that matters. Ashford's jaw tightened. He leaned forward. You had no authority to make that decision. You have no surgical training. You performed a procedure that, he stopped himself, seeming to realize the logical trap. If he argued that the procedure was ineffective, he'd be admitting it had been necessary. If he admitted it had been necessary, he'd be admitting that she'd been right. I have 4 minutes of training, Margaret said, and something in her voice shifted. Just slightly. A thread of something harder underneath the professional courtesy. That's the only training that matters in emergency medicine. I spent 2 decades learning what you can do with 4 minutes and a scalpel and hands that know how to work. So yes, I did it. And yes, he's alive. One tear escaped down Margaret's cheek as Chen handed her the suspension notice. Margaret wiped it away without breaking eye contact with Ashford, who was watching her face for some sign of breaking. Some sign that his power was working. She gave him nothing. Just her steady gaze and her measured breathing and the absolute certainty of someone who'd already survived things he couldn't imagine. By evening, Dr. Ashford met privately with Lieutenant Commander Morrison, the Coast Guard liaison who'd arrived to check on Commander Hayes's condition. The hospital conference room had been cleared. Just the 2 men and the unspoken weight of institutional authority. Ashford was all concern now, all professional damage control. I want to assure you that the nurse responsible for the unauthorized procedure has been removed, Ashford said, his voice carefully pitched to convey both regret and decisiveness. She will face full disciplinary action. We take patient safety extremely seriously at Seattle General. What happened was a serious breach of protocol, but I want you to know we've handled it immediately and completely. Morrison took notes, his face carefully neutral, his military bearing giving nothing away. He wouldn't smile. He wouldn't interrupt. He would simply listen and document and file away every word in the part of his mind reserved for inconsistencies and lies. Margaret learned of this conversation at 7 p.m. through a text from Jennifer, the ER clerk who'd been there during the code. Her fingers shaking slightly as she typed, he told the Coast Guard liaison you'll be prosecuted. Said you endangered Hayes. I heard it in the hallway. I'm sorry. 2 days later, Margaret's daughter Emily found her at Evergreen Cemetery, standing in pouring rain at a grave marked Captain James Walsh, U.S. Army, beloved husband and father. Her silver hair plastered to her skull, rain mixing with tears she'd finally allowed herself to shed. I tried to just be a nurse, Jamie, Margaret whispered to the wet marble. I tried to leave it all behind. I promised you I would finally be safe. I promised you I'd be invisible. That I'd rebuild. And I failed. I couldn't stop being what I was. I couldn't just let him die when I knew how to save him. And now it's all gone. Emily wrapped an arm around her mother's shoulders, saying nothing, because what words existed for a woman who'd spent 20 years trying to bury a soldier and couldn't manage it even when it cost her everything? What neither of them knew was that somewhere, in a federal office in Tacoma, a routine background check was being processed. The kind of check that gets triggered when a hospital credentialing review flags a name with specific security protocols attached. A woman named Margaret Walsh. Classified clearance. Department of Defense file. A name that, when run through the right systems, opened doors that very few people in Seattle General even knew existed. The wheels were already in motion. They just didn't know it yet. The wheels were already in motion. They just didn't know it yet. The routine background check triggered by Ashford's formal complaint arrived at the Federal Credentialing Office on a Tuesday morning at 9:54 a.m. It was a standard form, the kind that got filed every week, 1 nurse, 1 allegation, 1 institutional review. But somewhere in the Seattle General database, buried beneath 3 years of clean performance records and commendations, sat a name flagged for classified security verification. Margaret Walsh. Major, United States Army, retired. The form bounced to the Pentagon. Then to the VA. Then to a desk at the Defense Counterintelligence and Security Agency where an analyst named Rodriguez saw the flag and went very still. She picked up the phone and made a call that would reshape the next 72 hours. Nobody at Seattle General knew the call had been made. Margaret stood at the cemetery gate in the pouring rain, water streaming down her face like tears she wasn't allowing herself to shed. The marble headstone read Captain James Walsh, United States Army, and beneath his name were dates, born 1968, died 2019. 5 years gone. The rain hammered the grass around his grave like mortar fire, and Margaret didn't move. Her scrubs clung to her body, soaked through, and her hands, those steady, capable hands, trembled for the first time since the emergency room. Emily found her there, having driven from Seattle with 2 hours' notice and a terrified phone call to Margaret's house that went unanswered. Margaret's daughter stood beside her mother in the downpour and waited, because some conversations don't need words. "I tried to just be a nurse, Jamie," Margaret whispered, her voice cracking on her husband's name. "I tried to leave it behind, but I failed you. Failed our promise that I'd finally be safe." She pressed her palm against the headstone, water pooling in the carved letters of his name. Emily reached out and squeezed her mother's shoulder, and Margaret finally looked at her daughter, really looked at her, and saw James in her face. The same sharp jawline. The same quiet strength. Emily's eyes were fierce with rage. "He hurt you. The hospital, Dr. Ashford, all of them. What did he say to you?" But there was no time for that answer. Not yet. The hospital administrator called the emergency meeting for Wednesday afternoon at 3 p.m. The conference room filled with bodies, HR director, chief medical officer, 2 attorneys in expensive suits, and a woman Margaret didn't recognize sitting beside them with a manila folder the size of a brick. Ashford wore a confident smile, the expression of a man who'd successfully removed a problem. He'd already drafted a statement about the danger of allowing unqualified personnel to practice medicine. The smile died when Commander Hayes's daughter stood up. "I think you should know my father asked me to find out who Major Walsh really is." The HR director's hand shook as she opened the file that had arrived that morning via encrypted transmission from the Pentagon. Her voice barely held steady. "Margaret Walsh. Major, United States Army, active duty 2007 to 2019. Multiple deployments. Bagram Air Base, Kandahar, Helmand Province. Medical specialty, field trauma surgery." The room went dead silent. A Coast Guard investigator in dress blue stood, and every person except Ashford seemed to have been waiting for this moment. Major Walsh holds the Distinguished Service Cross for running into enemy fire to extract 3 wounded Rangers from a compound under direct enemy attack. He paused. The weight of what he was about to say sat heavy in the air. Bronze Star with Valor for performing emergency field surgery under direct enemy fire, saving 2 soldiers who would have died in transit. Another pause. 2 Purple Hearts. The second from the IED blast that ended her combat service. His voice dropped lower. Major Walsh saved 17 lives in conditions most surgeons couldn't imagine. In conditions most surgeons would refuse to enter. Ashford's face had gone grey. The color drained from his cheeks like someone had pulled a plug. His attorney tugged at his sleeve, but Ashford was frozen, staring at nothing. The administrator turned to him slowly. "The audit you demanded of Major Walsh's credentials triggered a federal review of all our files, Doctor. The federal review uncovered your pattern." The words came like bullets. "Altering post-operative medication records to hide complications. Ordering nurses to file false incident reports. Fraudulent billing for procedures you weren't qualified to perform. The very things Major Walsh was documenting when you began your campaign against her." The administrator's voice was ice. "We have 6 years of falsified records, Doctor. Patients harmed. Families misled." Within 48 hours, the medical board suspended Ashford's license pending criminal investigation. By the end of the week, federal prosecutors unsealed an indictment, 6 counts of medical fraud, falsifying records, endangering patients. His attorney negotiated a plea deal, 2 years federal prison for fraud, 5 years probation, and a permanently revoked medical license. The hospital's attorneys added one more condition. Community service. Specifically, a night security position. At the hospital he used to command. The other nurses learned the truth in fragments. Sarah found Margaret in the cafeteria on Thursday, her eyes red-rimmed and desperate. "Major Walsh, we didn't know. He told us you were dangerous, that you'd made critical errors." Margaret looked up from her coffee, her expression unchanged. "You left me alone in that break room without asking my side." Sarah's breath caught. "I know. There's no excuse." Margaret took one measured breath, then nodded toward the empty chair across from her. "Sit down, Sarah. Tell me how Commander Hayes is doing." Sarah sat, and for the first time in 3 weeks, Margaret didn't feel invisible. She felt seen. 6 weeks after her suspension, Margaret received a formal letter from Seattle General, full reinstatement, back pay, public apology, and an offer to direct the hospital's new trauma response training program. She accepted. On a Monday night in September, Margaret returned for her first overnight shift. She wore her old combat jacket over her scrubs, faded green, the 75th Ranger Regiment patch now visible on the shoulder where she'd moved it from its hidden place inside the lining. Against hospital policy. Administrator Chen had personally approved it. The jacket smelled like mothballs and memory, like the person she'd been trying to forget and the person she'd finally accepted she was. She walked through the ER. Every nurse she passed nodded with respect. Sarah hugged her without speaking. Marcus saluted, grinning. Katie cried. Commander Hayes was in room 218, recovering steadily, his daughter reading beside his bed. When Margaret checked his vitals, his daughter stood and embraced her. Hayes himself, still weak but alert, raised one hand in a salute from his hospital bed. "Major. Thank you for not letting me die." Margaret returned the salute with the precise economy of motion that came from muscle memory. "Rangers don't leave anyone behind, Commander. Not even Coast Guard." Hayes laughed, wincing at the pain. At 2 a.m., Margaret passed the night security desk on her way to check supplies. The fluorescent lights cast everything in that sickly white glow that hospitals perfected. The guard sat hunched in the ill-fitting uniform, his shoulders collapsed, his face shadowed under the desk lamp's cruel brightness. Dr. Ashford. Watching cameras now instead of patients. Monitoring the people he'd tried to destroy. Margaret didn't look directly at him, but she heard his breathing stop, a sharp intake of air, then nothing, as she passed. She let one corner of her mouth lift, just barely, and kept walking. The faded Ranger patch pressed against her heart where it belonged. She didn't speak to him. There was nothing left to say. Some silences carry more weight than any words ever could. In the break room at 3 a.m., Margaret poured coffee and 4 nurses joined her, Sarah, Marcus, Linda, Katie. They talked about patients, protocols, the impossible shift. Normal nursing conversation. The kind Margaret had been denied for 3 weeks. She closed her eyes briefly, feeling the weight of the jacket, the patch, the memories pressing against her ribs. When her shift ended at 7 in the morning, Margaret stepped into the Portland dawn. The rain had finally stopped. She pulled out her phone and texted Emily, "I think Dad would be proud. I'm finally both things, the soldier and the nurse. I don't have to hide anymore." The response came immediately, "He always was, Mom. You just needed to see it." Margaret walked to her car with the combat jacket visible, her posture straight, her hand steady, no longer invisible. If you're watching this story right now, you're probably wondering what you'd do in Margaret's position. Would you have kept quiet, or would you have fought back? Drop a comment below and let me know. Subscribe to see more stories of quiet heroes who carry impossible secrets, and hit the notification bell so you don't miss the next chapter. Like this video if you believe the strongest people among us are the ones nobody suspects.